There are lots of our parents, our grandparents, at a point in their lives, they begin to lose their sight. Sometimes we just say, "Oh, it's old age and that kind of things, but maybe it can be managed instead of they going completely blind. How can we do this? How can we help them to manage their sight at old age? We ourselves, what can we do so that when we get to their age, we won't go completely blind? Does the weather play a factor? What are the factors that can help us to have eyesight even at old age? I'll be speaking with Dr. Daniel Jemfi at the Savannah Opticals here in Tamale. He'll be helping us to understand issues the aged go through regarding their eyesight. My name is Martha Anabila. It's always a privilege to bring you good content of the Reflection Show. Let's go for a break. When we are back, we delve straight into amazing discussions. Do stay tuned. Welcome back from the break. We are going straight into the discussion. Welcome, Doctor.
Thank you, Martha.
Good to have you again on the show.
Good to be back.
So we want to help our parents and our grandparents, or even we ourselves as we are growing old, what we can do so that we can still see and we don't always have to go with a walking stick or go with our grandchildren to help us see. Why do let me say old age, why is a factor having eye issues to old age? Why is that?
Yes, when we talk of eye care, a lot of eye problems affect people of all ages. Yeah, because I don't know if you are aware, somebody can be born blind. There are people who are born with conditions that predispose them to getting blind or to getting other conditions that can lead them to blindness. Now, that aside, a lot of eye conditions, the risk of getting them increase as you grow older. There are a group of eye conditions that no matter what you do, once you are growing old, you either get close to having them or you eventually have them. And these conditions are classified in two types. There are some of them that can be treated or cured or say managed. And there are some of them that we can't do anything about. Now, when we talk about eye problems like that, first of all, we'll talk about presbyopia.
Hey,
Yes.
break it down.
Somebody asked me why we
Okay,
don't call it
because I sorry, Presby.
the Obi Bisa said, why don't we call it methodistopia? But that's what we came to meet. And presbyopia is kind of the first age-related problem you meet growing up. When we talk of presbyopia, it has to do with your vision becoming blurry when you are reading. So if you've realized, a lot of people, when they cross 40 years, 45, 50, they begin to wear reading glasses. And majority of people, the reason is that some muscles in the eyes begin to weaken, or the flexibility is lost from age 40 going. Some get it quite late, like 45 going. So because of this, they need some lenses to help them with reading. You see a lot of old people wearing their glasses this way. And it's not because it's a new style. It's because it's reading glasses. They don't want to walk with it. So they wear it this way. So they read with it and then still look far. It's an age-related problem.
Okay.
We have all these problems, which if you don't attend to, may lead to some other complications.
Okay.
When we talk of presbyopia, if you don't go to the eye clinic to take care of it, you begin to have a lot of headache. You have blurry vision shortly after reading. You look far and it becomes very blurry. Dizziness and all that, eye pains. That aside, we can talk of glaucoma. Glaucoma affects all ages, but
Even in children.
yeah, in children. There are children who are born with a condition we call ophthalmos. Ophthalmos predisposes a child to getting glaucoma. It means the eyeball will be big. There's probably high eye pressure, which may lead to glaucoma. But now that's not what we are talking about. We are talking of the age-related
Yeah,
type,
yeah.
which people may have very normal eyes growing up. You can pass 30, 40, and then after 45 going, your risk of getting glaucoma increases. So people are advised that from 45 going, every year, get your eyes checked to be sure you don't have glaucoma or you are not developing glaucoma, because it's a silent thief of sight. We know that from 45 going, a lot of people become hypertensive,
Yeah.
diabetic.
Yeah.
There's an eye condition called diabetic retinopathy,
Hey.
hypertensive retinopathy. And this is simply diabetes or hypertension affecting the retina of your eye.
Okay.
When we talk of, now let me come to this. When we talk of the retina of your eye, this is the model eye.
If you can have the camera zoom
Yeah.
into the eye.
This is your eye.
Yeah.
Now when this is open, like this, like the human eyeball,
Yeah.
this is what we call the retina.
Yeah.
You know, this colored part is called the retina.
Okay.
You see there are vessels in it,
Yes.
veins and arteries inside.
That's how they look in our eyes.
Yeah, when we look inside your eyes, this is what we see. This is what we actually see. Now the veins and the arteries are what supply blood to your eyes, from your heart all the way to your eyes. So if somebody has diabetes or hypertension, it means there's a problem with the blood flow, especially with hypertension. If there are veins inside the eyes, then a disease that affects the veins can affect the eyes as well, because there's going to be slow or reduced blood flow, blood supply to some areas of the body, including the eyes. So as you grow, if you become hypertensive, you become diabetic, it means that you should have time to always be checking your eyes regularly to make sure that what condition you are having does not affect the eyes, or it doesn't give you any complications in the eyes.
Okay. So it means that as you are aging,
Yeah.
your eye check should be something you keep doing, even though you may even have other health issues. They can be connected in a way that can affect your eyes.
Yes, yes.
Okay.
As you are growing older, you should increase the frequency of your eye check. There are people we meet who are like 25 and they say, I've never checked my eyes. They may probably have a clean health bill, like come out not having any problem at all. But you can't be like 45, 50 and you've never checked your eyes. It's serious.
Wow.
Yeah,
A lot of people haven't, especially
Yes.
even in Tamale. I believe people have been in Tamale 50 years.
Good.
35,
So it's
they
very
haven't
important.
checked it.
Yes, it's very important we check, because from 45 going, any systemic condition you are having is most likely going to affect other organs, including the eyes. So there are people with even like arthritis, which can also affect the eyes.
Wow.
Yes. Even menopause can affect the eyes.
Hey.
Yes. You know, there's this condition called dry eyes. Now, once there are hormonal changes in your system, the hormones also control tear supply in the eyes. Now, once there's reduced tear production in the eyes, you are most likely going to have what we call dry eyes. If it's chronic, then it means that every day you are going to have burning sensations, or you'd probably be always complaining of feeling of sandy sensation in your eyes. Yes, that is most likely age-related. Young people also get it, but the rate at which older people get it
It's
is
high.
higher. Yeah. When we talk of the prevalence of blindness, especially in Ghana, that's 0.74. Out of that, a lot of people are aged. Yeah. The rate at which aged people are getting blind, are getting eye problems is very, very high. Now, most of the time, people do not realize, because some of the conditions do not come with easy spots symptoms or signs. For instance, glaucoma. If it's making you blind, you don't feel any pain. You do not realize that of late when I wake up, I don't see very well. No. Before you know, one time, a side of your vision is very blurry. And after the examination, you realize that, or you are told that your eye pressure is high, and then you have to do certain tests
To
to
check
check
it
whether
out.
it's glaucoma or not. If you are not careful, it comes out to be glaucoma. There's nothing we can do to recover the lost vision.
Wow.
Yeah.
It can.
No, no, no. There's nothing so far that we can do to recover your vision if you lost it as a result of glaucoma.
Is it can one has gets glaucoma and cataract at the same time
Yeah.
in one person?
Yes. Thank you. You reminded me of cataracts. Yeah. So I I I don't talk too much of cataracts, though it's very, very important because it's readily, treatable.
Yeah.
Once you have cataracts, it blurs your vision. You can't see far. As soon as surgery is done, your vision is restored. So that's the only good thing about cataract. And it's mostly age related. If a child has cataract, then it is secondary to something else. Maybe a condition he or she has led to the cataract. Well, there are children who are born with cataract. And through surgery, the vision is restored. So definitely, if somebody has cataract, which is also age related, once surgery is done, the cataract is taken off. I come to this, and then let me show you something here for the cataract. When you look at this, when we talk of cataract, this is the natural lens in the eye.
Okay.
The natural lens is transparent. When it becomes opaque, it means what? Light cannot pass through it. So if light cannot pass through it, it means light cannot get to the back of the eye. So you can't see. Now, during cataract surgery, this is taken off.
Okay.
And an artificial transparent one is put there to make you see again. So that is how cataract is treated. And so because of the issue with glaucoma, that's why I talk about it a lot.
Yeah.
Because definitely, once your vision cannot be restored, it's worth talking about more. Because people do not realize they are going blind. And then most of the time, before they realize it is at the dead end of
Yeah.
it. And so the person probably sees somebody moving his fingers or sees lights. The only thing we can do is to help preserve the vision you have. Yeah, we can't add anything to that. If you have cataract contributing to the vision loss, the cataract surgery is done, leaving the glaucoma. So if cataract was contributing to a major part of your vision loss, hooray! You
It's
get
gone.
a lot of vision restored, and then glaucoma takes credit for the rest.
There are some who say they can see in the day, they can't see in the night. What causes that?
They
Or
can see in the day, they
yes.
can't see in the night. Yes. So there's another condition called retinitis pigmentosa.
No, doctor.
You asked me.
Yeah,
Yes.
retinitis
So yeah, there's
pigmentosa.
retinitis pigmentosa.
Okay.
Now it's largely genetic, meaning you are born with it. So if you are born with retinitis pigmentosa, or a condition that will predispose you to retinitis pigmentosa, it means that the cells in the retina of your eye that help you to see in the night, those cells are not working well. So you kind of don't see very well in the night. So we call it night blindness. Yes. So there are other conditions that contribute to night blindness.
Okay.
But I mean, regarding age-related blindness, retinitis pigmentosa is a contributor.
Okay, while
Yeah.
we digest retinitis pigmentosa or whatever it is, let's go for a break. I'll be right back. Stay tuned. Welcome back from the break. I believe that we are getting to learn certain things that probably we didn't know, or we're getting more enlightened on that. Now, we need to just focus that as you are growing, as you celebrate your birthday, the next year birthday, next year birthday, just get to know that your eyes too is what reducing in certain ways. Doc, now apart from having to check to get to know,
Yeah.
you mentioned that menopause could be one factor. The men, what are some of the factors they can use to know that child? I have to go and like check my eye and that kind of thing. For women, when or like obedru menopause, because actually this is a time I have to go, but is that something that men can notice
Well, definitely, if a woman is I mean,
in her
getting to
menopause?
menopause, a man is becoming what andropause. So definitely, once your wife or your classmate, your colleague is getting to the 50s, you are not left behind. So if your classmates are checking their eyes, you should also be prompted to check. And definitely, when it comes to the something like presbyopia, you don't have a choice. It's an automatic check. You used to read like this. Every day you just pick a paper, you start reading, and you are fine. And all of a sudden you pick it and you have to do this before you see it. You should know something is going wrong, you know. So you go for glasses. Now you can see it very well. You're enjoying it. After 2 years, it's no more clear.
Go and renew
You
the
begin to
glasses.
realize that no, it's getting worse. So you have to go get a review, check, and then maybe change it, you know. So after every 2 years, your glasses are likely to be changed. Yeah. It's going to be changed because what you were given last 2 years is not as effective as what you'll be given today. Yeah.
We see that
Yeah.
the medicine has finished inside.
So no, your glasses do not change. It's your eyes that are growing. So once your eyes are growing, your eyes are changing. What we gave you 2 years ago will not be good enough for the new eyes you have developed into. Yes. So last 2 years you used to see it this way. Now it's different. So you need a new pair that will help you. So you bring it this way again to be able to see it. Else you risk having a lot of headache. And once you get this frequent headache that you take para, it goes away. When you go to the office, by the time you close, the headache is back. You either check your BP, you check your sugar level, and then you check your eyes. Most of the time, it ends up being the eyes that have a problem.
Wow.
Yes. Yeah. It's something that happens in children, but this is the age-related type.
Okay.
So when it comes to the age-related type, it changes. As you grow older, you have to get the eyes checked to see if your glasses need change. That has to do with the optical side, with we call it refractive error. All eye problems that make you require glasses to see better are refractive errors. We're not going deep into that, but I mean, once the eye problem requires glasses to solve it, it is a refractive error. So presbyopia is a refractive error. That aside, the other issues are pathological. The pathological issues are the retinopathies we talked about. The ones that are caused by the diabetes, the hypertension, arthritis, sickle cell.
Hey, sickle cell.
Yes,
Wow.
I mean, people who are sickle cell patients may end up developing retinopathies as they grow older. At a point, blood supply to the retina will be impeded because the cells in your bloodstream are not the same. They are shaped unevenly in a certain fashion. So the flow is not well to certain areas of the eye. It may end up giving you something we call sickle cell retinopathy. There's something we call central retinal vein occlusion, central artery occlusion. There are a lot of eye problems that are age related.
Okay.
But the most important is once you check the eyes regularly, these things
You notice them,
are
prevent
noticed,
them, or
yes, are
reduce them, or
diagnosed early enough so that the remedies come to play, and then it's either we stop the progression of the problem or we treat it. So you
Okay.
are totally fine.
Okay.
So as I said, I mean, two sides. It's either it's treatable or it's preventable. If it's
Okay.
preventable, you prevent it before you get to that stage.
Okay.
Now, if it's preservable, it means the vision you have left, the vision you have left is going to be preserved.
Okay.
So once the vision is being preserved, it means that the how you see now is going to be controlled, so that the problem that caused the previous vision loss is not going to be continuous.
While you were talking, you mentioned some people just take the eyeglass it's just for reading.
Yeah.
But we hear that we see some people just wearing it like the whole day. They are not reading,
Yeah.
just walking with it. Like, are there types of glasses or types of infection that can affect the aged?
Yes. So I mentioned that refractive errors make you require glasses. There are different types of refractive errors. There are people who need glasses just for distance vision, and it's not age related. It's just because they have blurred vision from far. We say they have short sightedness. They only see when things are close to them. So because of that, they need glasses to see people from far. There are people who cannot see your face well, even from this close. Yes.
Wow.
Such a person cannot go around without the glasses. There are alternatives. So you may see the person without the glasses today, and he still sees you well from far. Probably he's wearing contact lenses, which is an alternative to your glasses.
That one is the one they just put inside the on top
Yes.
of age.
Yes. It's
That
fine.
one.
Once you are comfortable with it, it's a very good alternative to glasses.
So you just put it on your eye, or you have to remove it. Like, just put it on.
It's very flexible. There's an English word which succulent.
Age.
It's very, very, very flexible. It's a plastic material. They call it polymetal or metacrylate. That's the name of the material they use to make contact lens. And it's placed on this part of the eye. This is the cornea. And this is the part, it's very transparent. The part through which light passes and then gets to the back for you to see. So if you have a refractive error, contact lens is placed over this cornea, so that once contact lens is placed over this cornea, light passes through the contact lens before it gets through the cornea to the back of your eye. And that's how you get to see clearer. In the same way, your glasses is placed in front of your eyeball, you see. So you see the similarities. Your glasses is here, somewhere here, a little bit far from the cornea. But the contact lens is directly on the cornea.
Okay, yeah.
So it makes contact with the cornea. So the probability that you develop complications is higher. That's why you need a
Because you have to
professional.
keep removing it.
Yes, you are going to take it off.
Every evening you have to take it off before you sleep.
Well, there are types. There are types you can wear for a long time, but it's safest if you take it off every evening before you go to bed. Because anything trapped between the contact lens and your cornea is going to give you an infection.
Damage.
The commonest is what we call acanthamoeba keratitis. It's an infection that you get if
Doctor, what's it?
acanthamoeba keratitis. It's an infection very common in contact lens wearers.
Okay.
Yes. So it requires a lot of hygiene. If you are not well kept,
hygienic.
yes. If you are not well kept, you cannot handle contact lens. Yes.
So the agent can also wear it.
Yeah. Yeah. Everybody can wear
I
contact
think I see more of young girls wearing it than even the aged. It's just for the fashion sense of it.
I'm sure young people wear it a lot more because of the crave for fashion and people getting too tired of wearing their frames, because contact lens is more expensive. If you are going to wear it always, it's more expensive than getting glasses. If I get these glasses, only thing I have to do is clean it. If it looks blurry, I clean it and then I put it back. If I wear contact lens, especially if it is dailies, every day you have to take it off, dispose it. Yes, it's expensive, but you have to dispose it because it's unhygienic for the eyes.
I can't tell.
It's unhygienic for the eyes. So you take it off, you dispose it. If it is extended wear, you take it off, you clean it in a solution. There's a storage container we give you. You store it in there to clean the contact lens. The next morning you put it back on. Yes. So a
That's so
professional has to
stressful.
teach you how to wear it, how to clean it, so that if you have any challenge with it, you run back to him to take care of it.
Can some of those things be genetic? So maybe my father had an eye issue when he was 50 or 55. So it's like at that age, I also have an eye issue.
Yes.
Can they be genetic like that?
Yes. Yes. Just like cancer. If you have
The sickness we have been looking for the cause that we don't know what causes it.
yes, if you have a family history of cancer a lot, it means you are predisposed to having it too. Yeah, you're also at risk. The same way, if a lot of your family members get cataract at 50 years, it means you have to be checking the eyes a lot. If your mother, your father, your uncle, people who are that close, your sister, your brother has glaucoma, it means you are also at risk of having it. So it's largely hereditary, it's largely genetic. That notwithstanding, people who do not have any relative having any of these still get it. There are people we ask who cannot trace any family member who has any such problem, and then they still
It
have
could be their
them.
greatest
Yeah,
grandparents somewhere, but because they were
probably.
not checking,
Yes, yes,
uh,
most likely, most likely. So it doesn't. Even though we say that you should have a relative who has such a problem before you would be like you know that you are at a higher risk, you still have to be checking whether or not you know a family member who has it. Just as you said, it could be because your great grandfather had it, and you know we're all related in a way. Yes,
oh yes,
yes,
everybody,
because some of these problems are
yeah,
more African prone problems.
yes.
We are
Oh, everybody!
yes,
I
most
kept on
likely
Facebook. I said
at
in
risk.
Tamale, everybody knows everybody in Tamale. I know Doctor knows this person. By
I
the time
saw
you
I saw
know,
it somewhere.
uh, it's
I don't
it's
know.
it's.
I don't know a lot of people around here.
Oh, you don't know. A lot of people know you, Doctor.
I don't believe it.
Hey.
I don't.
Anyways, so now as at that age,
Yeah.
what should we know? So let's say if I have a father and a mother at that age, what should we know? I have a friend who, or not just I know adults that
Yeah.
sometimes it even get them depressed. Like they feel like, oh, I could see. How come all of a sudden I'm losing my issue? So I want to pick this thing. Like you said, I can see that something is, but I don't know whether it's a
Yeah.
tablet or it's a phone. What should we, the family members, know about our mothers, our fathers, our grandparents who are going through this issue? Because at that time they are even more depressed and they might
Yeah.
go through a lot of frustration that they'll even end up trying to push it on us. So what should we
Yeah.
know in trying to help them heal?
Um. Well, I believe that it's about time we demystify all these eye problems and then health issues that are age related, because most of the time when you begin to have some of these problems, you hear people say that, oh, it's my work colleagues, somebody doesn't
It's
like me.
cursed,
Yes,
yeah.
a family member has seen
You
me,
stole
you
someone's
know,
boyfriend, so they have done
progressing in
something.
life, and so they want to kill me. They are starting with my eyes.
Uh-huh.
They are age related issues. If you were not taking care of yourself, you were not taking care of your eyes, definitely some of these things are going to creep in, and before you realize, it's going to possibly make you blind. So it's good that we let such people all know that these are they are normal age-related health problems, and if you don't even tackle it the level where you are, it's going to get worse, and it will most likely lead you to blindness, which may not be reversible. Even if it is, most of them are very, very expensive. There's one of them I left out, which is retinal detachment. Now, there's retinal detachment, which may start slowly from maybe vitreous hemorrhage, vitreous detachment, and most of them are age related. Though I've seen very young people get retinal and then vitreous detachment, mostly it is age related issue. It's very expensive to treat, and at the moment it can hardly be handled in Tamale. We refer people down south, and then they see other eye specialists who are retinal specialists, and they do surgery on such people and they pay huge sums of money.
Wow.
just to get about half their vision
Vision
back.
back.
Yes. So even with that, if you delay too much,
It's
it gets to a point,
50-50.
yes, the earlier the better. So the reversal or recovery is even not a joke. You pay a lot of money. And I've seen people who couldn't pay, so they are still blind. They were trying to gather money, but at this time, I know that if they do it, the prognosis is not going to be good. So it's important that you take steps to prevent these problems, or as soon as you notice it, you take steps to reverse it or to take care of it, so that the ones that can be preserved, you start preserving your vision as early as possible, or you start treatment as early as possible.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of kingdom dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Welcome back to the Reflection Show with me, Martha and Abila. We will now want to look at how should children or family members understand elders, the elderly, when they are going through the season of their life, about to lose their sight.
Okay, I think I'll tackle it from before they get to that point, because a colleague once said something, and I think we have to really be using that. These birthdays thing, you mentioned it as well. So we celebrate our birthdays every day, every year, every year once. Now make it a point that whilst you celebrate your birthday, you
Go check your eyes.
I can't promise to do that on my birthday, because birthdays are busy days. Now I can say
It
that
depends though,
a day after my birthday, I'll do,
to go and check your
yes,
eyes.
a thorough health check, including my eyes. So whilst I do that, I should make it a point that I either remind my father, remind my mother, remind all the other elderly people around me to get their eyes checked, to get their health checked, because we are growing. You don't wait till you get to a certain level where certain issues are not reversible, and then you say, had I known. Now, even when you've gotten to the point where you've been diagnosed of certain eye conditions, with young people like us around elderly people, I think that we should always, know that this is a level where this person has gotten to. We would get there someday. What do I do for them? They need the emotional support. They need help. There are some people who are blind, and sad to say that some are neglected, left in their homes without any care, given to, some strange people to care for them. And some of these people hardly care for them the way they need. So if we as family members can give that emotional support to our people, our kinsmen who have lost their sight, who have gotten to the level where they cannot be on their own, it would go a long way to help them, because knowing that you have people you care about close to you, caring for you, taking care of your immediate needs, I think it goes a long way to psych them, to know that they are not dealing with this disability alone. You get, because At a level, it becomes a disability. And at that level, it means they need the people around them. So I would advise that we lend a hand to the older people around us. Today we are talking of the older people. There are young people who also go through the same stuff. And it is age-related thing. They are growing. So definitely most of them, their problems get worse. We call something low vision. Most often before people get blind, they go through something we call low vision. Low vision is the point where your eyes are very blurry beyond a certain limits, but nothing can be done about it. Now, if you have low
Like
vision,
no treatment, nothing.
there's no
Like,
treatment.
no medical science can help
Yes.
that.
Let me come again. After all possible treatments, their vision gets to a certain level, which is still not good enough to perform certain tasks.
Okay.
Yes. So they were probably seen very, very bad, but with surgical intervention, maybe optical intervention, maybe medication, it has brought them up to a certain level, but it is still not enough to perform certain functions. That is low vision. When you read on our charts, there are certain levels that it's somewhere halfway on the reading charts. So if your better seeing eye is at a certain level on the charts, it means you are low vision. With lens, without lens, you still cannot see beyond that level. You have low vision. Depending on what caused your low vision, you may be moving towards blindness. And that is how a lot of people, that's their journey towards blindness. Most low vision people need that support to know that they are from somewhere and their vision has gotten to this level. They are most likely going to get to the blind stage. So before they get there, what are you doing for them? Can it be controlled? Can their vision be preserved? What are you, where are you taking them? You see, there are people who have accepted that I'm already blind. There's nothing that we can do about it. But most of the time, there's a lot that can be done for such people. And it's all because they don't assess the facilities available for them. So they end up feeling that this is the end. And some of them stay at home, not doing anything, not having any, encouragement from people close to them. So they do not even visit any clinic. They have accepted their fate, not knowing that they are rather worsening their condition. You see, there are people who get to the level where, if they seek intervention, quickly a lot of things can be improved. Sometimes a lot of, some support can be rendered to them to even read small prints that hitherto they could not read.
Yeah.
Yes. There are low vision aids. There's a bar magnifier we can give to people who cannot read small prints. They put on the reading stuff, and then with that they can easily read.
Okay.
Because these things magnify the line no matter how small, and they are able to read it comfortably. Maybe not so comfortably, but it's good enough to let them entertain themselves whilst they are alone. They can read some stories. Yes. So there's a lot we can do to support people around us, especially when they have gotten to the low vision stage, in helping them to access facilities. There are people who have never seen the back of their eyes.
Hey.
We do something, yes. Okay, fine. Let me say a lot of people. Yes, you've not seen the back of your eyes, have you? You haven't. And it is because you don't know that there's a machine called fundus camera. There's a machine called OCT, which can assess the back of your eyes and get to know and explain to you, let you understand exactly what is happening behind your eyes. Exactly the reason why you cannot see very well certain things. Exactly why we say you have glaucoma. If you come to some of us, we will explain to you. I believe a lot of my colleagues do that. We'll explain to you to let you understand why we say you have glaucoma, why it may not be reversible. Yes. So we need to assess the facilities available and then understand. If your grandmother is not seeing well, get more information from medical personnel around you, so you can better explain it in the language that she would understand best. Because we get busy sometimes that we can hardly explain to your grandmother how she would understand that vision will not be improved.
Especially when you have
Yes.
certain things in the local dialect.
Thank
You have to take
you.
your time,
You
looking
know,
for an environment where she will not just go haywire. So I can't see again.
Yeah.
So I think people out there should be able to show that kind of
Yeah.
support, because
Very
the
important.
medical people cannot do all that.
No.
I believe when I come to your hospital, you are very busy, so you even get that time to give me all the
Yes.
explanations.
Sometimes just when you are at the waiting area, you'll be wondering why this doctor is keeping a patient there 20
Yeah.
minutes, 30
Yeah.
minutes, But when it gets to your time, you want to ask more questions.
Yes.
And when you're asking more questions, it's delaying somebody else too. And the doctor, it's down here, we don't work with appointments much. But if we are to be working with appointment, if I have to see somebody in the next 5 minutes and it's taking me about more than 10 minutes more to finish seeing you, definitely certain things are going to be cut short, especially some explanations are going to be taken out, and then we deal with the core issues. No, we deal with the core issues. Yes, so that fine, you can do that after.
Okay.
That's why some of us leave our numbers open, so that if you have issues, you can discuss with us. But still, I mean, relatives should get more information so that they can relate well and explain well to their aged relatives what is going on with their eyes. They are more comfortable with you if you are the ones explaining things to them. They understand it better from your perspective. Yeah.
Thank you so much, doctor. Give us your final words and then add up your contact details, if you don't mind, where you can be located. Now, I see that you have a branch in India as well. So give us all the contact details that we need to know and how we can find you.
Okay, so finally, I would say that we have so many aged people around us. When I say aged, I would not limit it to only pensioners. I would include the 45s going to our grandmas and grandpas. And that's a level we all want to get to, if God grants us. So we shouldn't take our health for granted. As I said earlier, let's try to mark our health dates with our birthdays, so that at least we know definitely once a year. Even if you want to make it every 6 months, your birthday should be one of them. So around your birthday, you get your eyes checked, you get your general health checked, and then know that this is where I am now. Take your doctor's advice very serious. You don't say that we go die, but you don't die suffering, So let's take our health.
Die well.
Yes, you die well. Yes. Die cry, well done.
Well done. When you are like 900.
Okay. Fine, but I mean, at least know that you are in good health. So we don't have to, ignore those signs when they start coming. When you realize that your vision has suddenly become blurry, please come. We'll take care of you. We'll advise you on what to do in order to preserve your vision. If it's treatable, we'll start taking you through steps to get your blurred vision or your blindness treated or managed. Yes. They are very key words we need to take note. If your doctor tells you that your condition can be managed, it is different from it being treated. The treatment falls under the management, but most of the time, if we are going to manage it, you should be patient. You should understand what we are dealing with. If you have relatives around you, it's important that you always let them know that you are there for them, because you get there someday as well. We shouldn't let it look like it's their turn. We should let it know it's not a mystery. It's health. And if you don't handle it well today, it can come back to bite you tomorrow. It's very important. Let's take our health into our own hands.
Yeah.
Yes. Savannah Opticals, we just started a new branch in Yendi. So in Tamale, we are directly opposite the main VRA commercial office. on top of the Sabonkudi Plaza. And in Yendi, the office we started last month, which is doing amazingly well. We are seeing a lot of people in Yendi.
Hey,
And it's
doctor.
a blessing to be there for people who, you know, there are eye care professionals in Yendi, but we are helping the work they do there, and we're enjoying doing that. Yes, we are enjoying doing that. So in Yendi, we are on the Municipal Assembly Road, just on the Zoom Lion Junction, the junction that leads to the Pentecost Church. So you can always reach us on our cell phones and our office lines. You can call us on, should I give the number out? 0200 252386. Or you call us on 0240 222 805. Yes, any of those numbers you can reach us and then discuss your eye care issues.
If you also want to reach doctor at any time, just send us an email or official numbers on the screen 0549578512, and we'll be more than glad to share his contact details with you. So in Tamale or in Yendi, after watching this episode, take your parents, your grandparents, your aged relatives to Savannah Opticals in Yendi or in Tamale or any eye care facility around the world for them to check their eyes, because we actually want everybody to stay strong and stay healthy. My hair and makeup is by Indus Beauty Salon here in Tamale. Get their contact details on the screen. We are still calling on partners and sponsors of the Reflection Show. 054957851 to give us a call for amazing packages. My name is Martha Anabila. Thank you for watching the show and have a good night. Hello and welcome to Thoughts from Martha Inspires. I am Martha Anabila. Today I want to talk to you about what I have captioned, do you want to grow? There are lots of times we say, I want to grow, I want to become bigger in this, I want to become bigger in that, but we don't plan ourselves for the price we have to pay. In your career, do you want to grow? Even in age, do you want to grow? In your Christian life, do you want to grow? In your business, do you want to grow? Are you ready for the price, for the disappointment, the issues that comes with growth? As you are growing, are you sure that you want to grow? Because growth is painful, growth is selfish, growth is annoying, growth is something that will make you feel uncomfortable. Every business person understands that if you want to grow, you have to make a lot of sacrifices. Are you ready for that kind of sacrifice? Are you sure that you want to grow? In whatever endeavor you are partaking in life, I want you to understand that there is a price that you have to pay for you to grow. Sometimes we are like, oh, I want to grow, I want to do this, I want to do that, but we have forgotten that there is a serious price that we have to pay for us to grow. And we end up thinking that, oh, because this didn't work and that didn't work, I am quitting. If you want to grow, you have to be ready for the price, be ready for the sacrifices, the disappointment, the pain, the anger that comes with growth. Growth is not easy. And as every young person watching me today, understand that there is this kind of pain, emotional pain, psychological pain that you will encounter at every level of your growth. So if you are growing in business, you are growing in health, you are growing in age, in any way that you are growing, understand that there will be challenges, there will be issues. People will leave you, they will become angry with you, and they will hurt you. But you know what? There is always light at the end of the tunnel. Whatever you are going through, whatever issues you are facing, is part of the growth that you are seeking for. It's part of the growth that you are hoping for. So be able to understand that you need to pay for the price. Pay for the price. And the price comes in different ways. The price comes differently from different people. Somebody can be paying the price differently, but you will not pay the same price. So if you want to compare your growth with other people's growth, then you would never be able to grow in the way you have to grow, because growth is different. Grow gracefully. Grow graciously. Grow according to your strength. Do not copy people's growth. Grow because it's something that is going to make you outstanding. It's something that's going to make you great and amazing and wonderful. Growth is good. Growth is wonderful. But do not copy how people grow, because your endeavors and your growth would never be the same as other people would grow. So if you want to grow, understand the process, understand the mandate, and grow in that endeavor. Don't say, oh, 2-3 years, nothing is coming on. I'm not seeing profit. I'm not seeing that. Growth is painful. Growth is annoying. Growth it's something that is not pleasant. Growth is not easy. I believe that if you have watched this episode, you've understood that you have to go through the process of growth and be the best version of yourself, and don't compare any other person. Thank you for watching today's episode on Thoughts from Martha Inspires. I am Martha Anabila. See you next time.